Okay, class. Next to present is Mr. Calvi. A round of applause, please.
Hello everyone. My name is Nefer Calvi and this is my story.
Aray, hindi ko na po kaya to. Sige pa po, mami, kaya mo yan. 1, 2, 3, push! Aray, hindi ko na po kaya to.
Sige, sige, push lang. Sige, push lang, mami. Malapit na si baby, nagtigilan. Sige, push lang. Ayan na si baby, mami. Baby boy Calvi out. At
5:56 daw.
good job, mami. So, mag-picture muna kayo ni baby saglit.
Tingin dito, ma'am. So now, Nurse Asher, let us obtain the UPGAR score of the baby. So the activity or muscle tone is 2 points since the movement of the baby is active. Then his pulse is over 100 beats per minute, 2 points as well.
So, remains active in motion, 2 points. And also 2 points for his appearance since his skin is completely pinkish. And for his respiration, vigorous cry, 2 points also.
So the UPGAR score of the baby is 10. He is in excellent condition.
Hello po, ma'am. We're here to check your vital signs.
Morning. So how are you feeling, ma'am?
Okay lang naman po ako, nurse.
May masakit po ba sa katawan mo?
Wala naman po so far, ma'am. Pero may concern lang po ako.
Ano po yun?
Kasi tuwing nagpapa-breastfeed po ako kang baby, hindi po siya nagla-latch. Worried lang po ako baka hindi siya nakatanggap ng sapat na breast milk from me.
First time mother po ba kayo, ma'am?
Opo. Hindi ko talaga alam if saan yung mali sa pag-breastfeed ko ba or yung sa ka-baby po may problema. Hindi ko talaga alam.
So since oras naman na po for another breastfeeding session ni baby, pwede po ba namin kayo makita kung paano nyo pinag-breastfeed si baby? If okay na po sa inyo?
Oh, sure. I don't mind.
Oh, Nurse JC, you're here.
Yes, Nurse Asher. Nagkaroon kasi ng emergency si Nurse Kyla. Sige po, ma'am. I-demo niyo na po.
Start na po ako.
Yes po.
Ganito na ba, ma'am?
Okay na, Mrs. We've seen enough. Ngayon po, ma'am, magpa-perform po kami ng breast assessment and the ability of the baby to latch on your breast. Okay, the ability of the baby to latch has been observed earlier. Thank you po, ma'am.
Thank you po.
So our nursing diagnosis should be ineffective breastfeeding related to knowledge deficit as evidenced by expression of or difficulty in breastfeeding.
Right. So now we just have to do the planning and then the intervention.
Yes, but before that, tingnan na tayo, be. Pagod na talaga ako.
Oo nga, ako rin eh.
Okay, now that we already have our nursing diagnosis, which is the ineffective breastfeeding, let's proceed to the planning and intervention. So, let's formulate first the plan.
I already discussed this case with Nurse JC a while ago. What do you propose, Nurse Erica?
Well, I think we first need to provide emotional support to the mother. It may take some time for her to learn the effective breastfeeding, but let's just support her emotionally all throughout the process.
Okay, that's one. What else?
You can also teach the client to recognize early cues from the infant for early breastfeeding.
Okay, that's one. Let's do that too. And let's coordinate with the lactation consultant para maturuan niya si mother the proper breastfeeding positions, feeding schedules, and all that. Meron pa ba kayong naisip na intervention?
Wala na, tingnan na yun.
Okay, that's great. Good job, everyone.
Hi! So we will now show you on how we implement each intervention, starting off with providing emotional support to the mother.
Emotional support allows people to express their feelings, and mothers need emotional support to sustain breastfeeding. If mothers can recognize, understand, and communicate their needs to other people of social network, they will achieve successful breastfeeding. Significant others such as the husband, family members, and health providers play an important role in meeting breastfeeding mothers' emotional support needs.
Next intervention is we're going to teach the mother on how to recognize feeding cues.
These are the signs that your baby is hungry. If you notice them, feed your baby right away. Fist moving to mouth, head turning to look for the breast, becoming more alert and active, sucking on hands or lip smacking, opening and closing of the mouth.
Once you've learned to read your baby's cues, you can better respond to his or her needs. Now, let us proceed to our last intervention. We are going to coordinate with a lactation consultant.
A lactation consultant is a certified health professional who specializes in breastfeeding issues. They help instruct on breastfeeding positions, feeding schedules, increasing the milk supply, and using a breast pump. They are breastfeeding advocates who can help from before your baby is born until the final weeks of weaning. They work with mothers to understand their goals for breastfeeding and help them put together a plan, while also answering any questions they have related to breastfeeding.
Ma'am, so sabi na po namin lahat ng kailangan nyo malaman about sa breastfeeding. So, meron pa po ba kayong tanong, ma'am? Okay, ma'am. So, uuna na po ako. Nurse Asher J, punta na ako.
Sige po, ma'am, sir. Thank you po.
Anytime.
Ngayon po, ma'am, kami po ay magpapandak po ng evaluation. Sa ganun po ay malaman namin kung naging epektibo po ang interventions na ginawa po namin. Okay lang po ba yun sa inyo? Sige po, ma'am. So, ngayon po, magtatawag po ako ng female nurse para po maging komportable po kayo during the evaluation. Since kasali po sa evaluation nyo ang pag-demonstrate ng proper breastfeeding. Wait lang po ha, tawag na po si Nurse JC. Okay po.
So, good afternoon, ma'am. So, ako po yung mag-evaluate sa inyo ngayon. Shall we start?
Yes po.
Okay. So, ma'am, can you tell me the benefits and importance of breastfeeding?
So, breastfeeding po is important for mothers and babies. Our breast milk protects our babies against a lot of illnesses and conditions po. And it is designed to meet our babies' every need po.
Very good po, ma'am. So, now can you demonstrate the proper breastfeeding technique? Yung tinuro po sa inyo kanina ng lactation consultant?
Yes po.
Okay, ma'am, can you demonstrate it?
Yes po.
Congratulations, ma'am. So after 4 hours of nursing intervention, you were able to understand and verbalize the importance and benefits of breastfeeding. And you also demonstrated the proper way of breastfeeding technique. So congrats again, ma'am.
Thank you po.
Okay, goodbye, ma'am.
Goodbye.
Good morning, ma'am. Ako po si Kayla Gregorio at ako po ang magiging nurse niyo for today.
Magandang umaga, nurse.
So, kamusta naman po ang kalagayan niyo, ma'am?
Okay naman po. Kaso naninibago pa rin ako kasi first time mother ako and hindi ko pa rin alam paano alagaan si baby.
Don't worry po, ma'am, kasi yun po ang sadya ko dito. Tuturuan po kita kung paano mag-alaga kay baby at paano po alagaan ang iyong sarili.
Okay po.
So, ang objective po ng teaching plan natin today ay first is, kailangan po ma-identify ninyo lahat ng kagamitan na kailangan sa pag-aalaga kay baby. Second is, kailangan nyo din po ma-identify ang function or ang gamit ng bawat bagay na kakailanganin sa pag-aalaga kay baby. And lastly, ay kailangan nyo din po malaman kung paano ang tamang pag-handle kay baby. So, ready na po ba kayo?
Opo, handa na.
So, wait lang po. So, may papanoorin lang po kayong video. So,
So ma'am, this is for evaluation. May tatanungin lang po ako sa inyong questions and i-answer niyo lang po based on your understanding sa video. So, based on your understanding, what is postnatal diet?
So after delivery, the mother's body needs to heal and recover from pregnancy and childbirth, as well as to produce breast milk. Mothers need to maintain a healthy diet so that they can be healthy and active and be able to care for their baby.
Next question, why is postnatal diet important?
A nutrient-dense diet full of complex carbs, fiber, healthy fats, and protein, plus adequate hydration can help heal your body. A healthy postpartum eating plan is the way to go to starve off bone loss, replenish your iron stores, head off hemorrhoids, and much, much more.
What foods are best for breastfeeding?
Include protein foods 2 to 3 times per day such as meat, poultry, fish, eggs, dairy, beans, nuts, and seeds. Eat 3 servings of vegetables, including dark green and yellow vegetables per day. Eat 2 servings of fruit per day, include whole grains such as whole bread, pasta, cereal, and oatmeal in your daily diet.
So that's it po, ma'am. Very good po for being able to answer my questions. Thank you po.
Thank you po, nurse.
Magandang araw po, Mrs. Ako po si Erica Lazo, ang nurse niyo po ngayong araw na ito.
Magandang araw din po.
Sino po yung watcher ninyo?
My husband po, bumili lang ng lunch.
Sige po, antayin na lang po natin siya makabalik para ma-explain ko po sa iyo yung mga discharge instructions.
Sige po.
Kamusta po yung pakiramdam niyo? May masakit po ba?
Medyo masakit po yung bandang tahi ko. Oh, look, nandito na palang husband ko.
Magandang araw po sa inyo, Mr. Ako po si Erica Lazo, ang nurse niyo po for today.
Magandang umaga rin po.
Nandito po ako para i-discuss ang mga discharge instruction po. Congratulations po on the birth of your baby.
Thank you.
In preparation po for the discharge, I would like to review warning signs and home care instructions. After discharge po, please notify your healthcare provider immediately if you experience any of the following or anytime you feel that the condition is an emergency. So, first po is if ever there's a heavy vaginal bleeding. It is normal to have bright red bleeding for the first 2 to 3 days.
after delivery, but we expect that your vaginal bleeding will continue to lighten up in amount and color over the next 6 weeks. It is normal to experience an increase in bleeding when you are more active or during certain stages of uterine healing. Your menstrual period may occur as early as 6 weeks to 2 months after your delivery. Signs of infection such as vaginal discharge with a bad odor and temperatures over 100 degrees Celsius. And difficult, painful, or too frequent urination or pain that becomes worse or unrelieved by medication. Next is if your breast can also become infected, please watch your burning pain and red streaks or lumpy areas in your breast that may be accompanied by flu-like symptoms in the postpartum phase. So some women experience preeclampsia or increased blood pressures. If you experience any of the following signs and symptoms, you need to be evaluated by your provider. So tawag lang po kayo, ma'am. If you develop difficulty breathing, chest pain, dizziness, or faintness, it is common for postpartum women to experience the baby blues in the first 2 weeks. However, if these symptoms last longer than 2 weeks, it is time to seek help. Now let's review your home care instructions. So rest frequently and continue to drink plenty of fluids and eat high-protein meals. Gradually increase your daily activities until you're back to your normal routine. Do not put anything in your vagina for the first 6 weeks after the delivery. This includes avoiding tampons, intercourse, and douching. These things can put you at risk for infection. It is important that you change your pad on a regular basis. It is okay to shower or tub bath. Postpartum constipation is common and may be increased by the use of higher narcotics or abdominal surgery. In addition, there are several over-the-counter remedies to alleviate discomfort, such as stool softeners or laxatives. So avoid heavy lifting. Don't lift anything heavier than your baby or above 10 pounds for 6 weeks or until your provider tells you. You may find it helpful to apply pressure to your incision with a pillow or abdominal binder while laughing, coughing, or getting up from a lying or sitting position. Avoid bathing or soaking your incision in water until 6 weeks postpartum or until approved by your provider. So it is okay to shower, just pat dry your incision after. Whether it is your first time or not, becoming a new mother is one of the most exciting and defining moments of a woman's life. So thank you for letting our team be part of it. So please let me know if you have any further questions or concerns before your discharge home from the hospital.
No, I don't have any questions. You've thoroughly explained it all. Thank you, Nurse Erica.
Thank you for listening, ma'am, sir. Goodbye.
Bye.
Mahal, may baby boy na tayo.
Sino yung wala na magkatawa ko? Ayan na si Mommy Baby.
First time mother po kayo, ma'am.
Opo, hindi ko talaga alam kung sa...
How are you feeling, ma'am?
Okay na lang po ako ngayon. Aware po ang mali sa pag-breastfeed. Mali sa pag-breastfeed ko hours. Aware lang po ako baka hindi siya nakakatanggap ng sapat na breast from me.
Nakabali po kara. Dila, Ma'am Joe. Kasi gusto sa over JC natin. Oh my God. Isi niya na ko yun eh, oh, Andres.
let us proceed to our last intervention. We are going.
Ako, if hindi siya nakakalap ng sapat na breast milk
See, it's easy to ignore trouble.